My name is Leferink, and I will shortly introduce myself. Actually, I wanted to be a musician or a software engineer, but I wasn't smart for both of these. So I studied public administration, and I started working in healthcare companies. And actually, after a year of, I think, 8, I was a very early rebel, I guess, because I already thought, well, I've been working here for 10 years, but I never did something for nurses or doctors, so maybe there's something wrong. And then, to my luck, I encountered Jos de Blok. He was a nurse, and he said, well, I start my own nursing company. And well, I joined him on a free base because there was actually no budget or nothing at all. But we started Buurtzorg, and to give just a little overview of Buurtzorg, I hope it's possible to share my screen. You see all my screen?
Yes, I do.
Okay. Well, I like to see Buurtzorg as an organism, and actually, when you look at the the Buurtzorg company, we started in 2007, actually with one team and four nurses. But in the years there afterwards, we grew to 12,000 employees and 900 teams with a turnover of something like 420 million euros a year. And it was all based on a natural growth. And actually, these teams, I guess it's a little bit like the micro enterprises. They are split when they grow, and when they're more than like 12 employees, we split team up, or the team splits itself. It's all based on self-organization within a very clear framework. Back office is only consisting of 52 employees. The only thing we have is 21 coaches who are focusing on the health of the teams, and 2 directors. And actually, I was asked to tell something about management and management tooling, but that's a little bit difficult when you haven't got any management at all. So it's difficult to talk about management tools. But actually what we do is we continuously monitor the health of the Buurtzorg organism. And then we have an open talk about right interventions to possible risks. And I can explain a little bit about that. Actually, our organism health check is very, very simple. We have 2 types of monitoring. One is about the metrics, the KPIs, but we keep them very simple. And the most important thing, I guess, is that we focus on a team level, because teams are the most important thing. We never show any information on an individual level or a larger level. Teams has to do it, and teams got their own team dashboard, and they can compare themselves to other teams. And the most important, or actually the only KPIs on this dashboard, is about customer satisfaction, the NPS, but then focusing on patients and not on customers. Productivity, and I think it's important to say that it's only about a simple productivity figure. We don't give them any financial numbers, because otherwise nurses ask for financial courses and so on. We give them just how much time do you spend with patients, and how much time are you getting paid for. That's productivity in our opinion, and that's, for us, it's enough. For the teams, it's enough to know if they are doing financial well, and they can compare it to a goal of the organization, and they can compare it to the other teams. And then they've got an important KPI about the customer segments, and in healthcare it's called patient mix, because we think teams are healthy when they help different types of patients. When you only get one type of patient, then the skills are getting lessened in the team. So they have to it's good for them to focus on different types of patients. And for example, terminal ill patients or chronic patients, they are very different to help. So that's important for them, that they look after their own mix. And there's a registration about incidents when somebody, a patient falls out of bed of giving the wrong medication. That's very strict incident registration. It's also due to national laws. That's the team dashboard, and that's actually the most important one when it comes to metrics. And on an organism level or organization level, whatever you want to call it, actually we focus on two things: the employee satisfaction. Every year we do employee satisfaction research, independent. We won it several times because we were the most best place in Holland as an organization. But I think it's very important for us to understand if our employees are very happy. And then the other one is, of course, financial sustainability. But actually, the most important thing is that there is enough income to cover all costs, and that's the main force when it comes to. That's why I call it sustainability. It's not about profits or anything else. It has to cover all the costs. But that's about the metrics, and I think they're still very simple. And in time, people want to add more and add more and add more, but actually we don't add any more because we think it's enough for the last 15 years. So it has to you better have very good arguments when we add an extra KPI. But I guess what's more important than these metrics are the soft signals, and what's very important in our organization is that we have a digital community, and this digital community is used by the entire organization, and actually it's the only way to read about the organization or to read about others, and it's not a rocket science. Actually, I tried to start communities. Back in time, we called it intranets in organizations and in bureaucratic organizations, but I never saw any successful community. But within Buurtzorg, we started this community, and actually by the way of communicating by Jos, the CEO. It was very social communicating. Well, I've got questions, I'm not sure, and all these kinds of posts, and everyone feels free to comment on all kinds of organizational stuff. And for us, it's become a very important place to understand how people are doing and what problems teams are encountering with, for example, GPs or hospitals, or knowledge about specific diseases or whatever. So we clearly focus on this digital community, and I'm really for sure that if this digital community dies, when people don't feel free anymore to tell what's on their mind and what's bothering them, then the backbone of the organization, of the organism, is dying. So for us, it's a very important place. And so that's where we also look after the soft signals when people have questions or complaining or whatever. And we never threw away one comment or one post in these 15 years. Sometimes it's difficult when you see a post and you think, wow, that's not what I really want to read. But we also said when we ever delete one post from an employee, then it's like a death penalty. So we have to be sure that this digital community is being very healthy. So we can read out every soft signal about how people are doing and how patients are doing and how actually the organism is doing. Besides that, we've got digital stand-ups with the coaches. And thanks to Corona, we made it more digital. And it really helps. It's the CEO with the coaches on regional basis, 3 times 8. We would just check out: are there anything new? Are there any problems? Are there any insights we need to know? Is there anything happening? And I think it's monthly, maybe sometimes once or 2 months. And besides that, if there is anything specific going on, and for example, COVID-19 is a crisis for a healthcare company, well, we did digital stand-ups on a daily basis. we just created a task force with 8 people, and we didn't even know, but we had one nurse who also was a epidemiologist. Yeah, it's a very difficult word in English. Epidemiologist. And he or she joined the task force and had very good insights, because our national government did all kinds of decisions who were not really helping us. So we, with this daily stand-up with a specific task force, we actually did very well during the pandemic, and still are doing very, very well. But that's actually the way we organize and the way we check the health of our organism. And that's actually what I wanted to tell, because otherwise I can tell for hours and hours and hours, but that's not really the plan. Thank you.
Thank you, Ad. A very exciting story. And I wonder if you could just say a bit more about the impact of the crisis. I mean, for many 20th century organizations, this was a shattering crisis that turned everything upside down. But my sense is that although it was difficult, although there were certainly disruptions, that Buurtzorg actually coped remarkably well. Could you say a word about that?
Yes, because what happened in Holland is that there was an approach to this pandemic. They wanted to organize everything in a central way. And actually what we very early encountered, and also thanks to all kinds of international connections with startups in a lot of different countries, we had a lot of international information that something really severe was coming on. So we, in the early stage, we started to buy all kinds of helping aid. How do you call it? These materials for working safely. Actually, the government said, well, it's not needed because the national guidelines were telling us that we didn't need it. But we did our own course, and it was very due to this daily stand-up where all the information from the different cells came up, and also from other countries, and all this knowledge from everywhere. We just did our own course. We followed our own course when it comes to testing of employees, and when it comes to buy all kinds of medical stuff. And this really agile environment where people feel free to help us. And we actually, people were making face masks when they were out of face masks, and people started to create their own, and really helped people in the community started to create face masks, and everyone was it's also very important to understand for people that it helps. Although the national guidelines said, well, that doesn't help. Don't wear any face mask because it doesn't help. And actually we did, because people felt free, the patients felt good. And afterwards they said, well, actually, it was a very smart thing to do. But we didn't follow the national guidelines. We just followed what the nurses said we should do.